This segment of Delmarva Life is brought to you by Peninsula Home Care.
About 10,000 Americans will turn 65 this week alone, and as the population ages, the need for senior care increases.
Yeah, but for many of these older Americans, home is where the heart is, and that's where they want to stay. And now experts say that more people are choosing to stay there, a trend that could save both money and dignity.
We got married in July 1984, married 30 years. In fact, there's our wedding picture.
Pat Swindler always wanted the best for his wife Sharon. When back surgery and deep vein thrombosis confined her to a wheelchair, the Swindlers didn't want to be anywhere but home.
Her condition started worsening. I'd have had to put her in a nursing home or extended care facility, which is very expensive, and I'm not a rich man.
Pat turned to the internet to research a movement called Aging in Place.
From there, Sharon's able to sit in the tub.
He found Kathy Simoneau with Acadian House Kitchen and Bath. She's a certified Aging in Place remodeler.
Sharon's wheelchair really did not fit into the master bathroom. So in looking at the hall, there was a problem, of course, with the doorway. It was only 24 inches wide. Well, we increased that to 36, did a double door, and the door swings both ways. So Pat could have her in there and get the doors out of the way and into the hallway.
Simoneau, like other certified Aging in Place remodelers, is specially trained to design every feature with a purpose.
When you're aging in your home, you want the spaces to be comfortable, usable, and accessible.
These floors look like wood, but they're actually porcelain tile. It lasts longer. It's easier on the wheelchair. The once compartmentalized master bath transformed to an accessible space. Walls knocked down, the commode moved, stylish grab bars installed, and the vanity lowered.
Wheel her right up there and let her comb her hair and brush her teeth and all that, and she was really happy to be able to do that. Because before, I'd have to sit her at the kitchen table with a little bitty small mirror and let her brush her teeth there because she couldn't get to the bathroom.
Now, sadly, Sharon only got to enjoy her new bathroom for a short time. A pulmonary embolism proved fatal last month, but her husband Pat takes comfort in knowing her final days were spent at home, and he encourages others to consider the same thing, aging in place, before going to other alternatives.
Well, Sharon was able to stay home because she had her loving husband to help take care of her, but not everyone is that fortunate. You may remember back in December, we met 93-year-old Lucy Graff. She's lived alone since her husband passed away several years ago. Chronic health conditions had Lucy in and out of the hospital, but that all changed when she started using the services of a community health worker through a pilot program made possible by a partnership between Peninsula Home Care and PRMC. Now, because of the visits, Lucy is able to stay in her home where she wants to be. Well, the Community Health Workers Program is now fully up and running, and as I found out, not only is it keeping people out of the hospital, it's giving some the freedom to get out the house. Without a cane, Mildred Wilson of Salisbury can't get far. She has an electric scooter, but it's tucked away in a back room.
I thought if I had a scooter that I could leave here and go at least two or three blocks every day and see people and meet other people, and them to get to know me, and then I would be able to feel like I'm part of the community, part of the family.
But Mildred can't get out the front door without a ramp, so she spends most of her time alone in her chair.
Okay, Miss Mildred, I'm going to take your blood pressure right now, okay?
Except on the days that her community health worker, Chantel Mitchell, stops in for a visit.
I come in here, I take her blood pressure, 148/32.
Thank you.
I check her leg. Oh, it's healing up a little. Make sure she has all her medications. And if it's anything that she needs me to do, I'll make a phone call to the doctor or whatever she wants me to do for her.
Community health workers serve as liaisons between healthcare, social services, and the community.
The whole idea behind the program is that we reduce readmissions and help people manage their health.
Peninsula Home Care Branch Director Nancy Bagwell says they add another level of care by providing proactive and preventative care in the home.
We've hooked people up with our food banks. We've actually gone and had transportation provided. We've assisted with Medicaid applications. We've assisted with getting medications that people were never able to afford or didn't have access to. So it's been a great experience.
Mildred has reflex sympathetic dystrophy syndrome, which leaves her with chronic pain. She says that, along with back problems, landed her in and out of the hospital and a nursing home. But home is where Mildred's heart is.
Now I'm home, I'm fighting it. I'm not going anywhere else except home.
Chantel and other community health workers are required to participate in training sessions to prepare them for the job.
They had to have training in behavioral management, how to coach. They had to learn to conflict, how to manage that, how to manage if they're going into people's homes where they've never been before, and how to make those people feel comfortable that they were there. So we really wanted people, that was another reason for having them from the community as well. It's not only the person that you see as your healthcare representative, but maybe you see them in the grocery store or while you're out shopping.
For Mildred, having Chantel here means more than that.
It's like having next thing to a friend, and when I need her, I can call her. And she's usually here in just a matter of minutes. I have to respect what she's doing that day. But it's nice to have someone that close that I can call.
And Chantel knows all about Mildred's desire to get back out into the community.
Yes, and she's very determined to get outside, so that's why I made the call to the MAC Center. In July, they will be starting to build a ramp out for her.
She certainly did, and she's had people coming over here that I don't even know. I can't remember who all she called and what they're supposed to do. And the lady says, "Do you need a ramp?" I said, "I need one horribly," and I'm trying to figure out how in the world does she know that I need a ramp. And it's her. She says, "Oh, I know Chantel real well." So Chantel seems to be going out there getting me more than what I even bargained for.
And that includes something Mildred wasn't sure she would ever get back: independence.
I'm going to get out of this house for one thing, and I'm going to know my neighbors for another. And hopefully I'm going to try out the battery to see how far I can go. And I know that I'll take it just as far as it's going to go.
Peninsula Home Care has 3 community health workers. Their service is provided through a doctor's referral at no charge. People receiving the services are not required to be identified as homebound or fit the same criteria as home care patients.
She's going to get out of that house.
She is.
Yes, she is. Now, if you're planning on heading outside of the house, be sure to protect yourself from the sun. Still ahead on Delmarva Life, melanoma is the deadliest form of cancer, yet the most preventable. More and more people are getting diagnosed with skin cancer every year. You're going to find out who's most at risk and the simplest way to prevent it.
And later, a sunburn isn't the only thing that can leave your skin red and itchy this summer. We'll tell you why this year could be the worst for poison ivy and the little phrase you need to remember to avoid it. Delmarva Life will be right back.